So, dear colleagues, I'm happy to introduce you my lecture about the healthcare system in the Republic of Macedonia. I'm going to the actual topic of my lecture. When I may make a comparison with the data which Professor Iso presented about Japan, it seems pretty different because Macedonia is a very, very small country. It has 2 million inhabitants. And it lies in the southeast region of the Balkan. And some usual general indicators for the health system or for Macedonia. Demographic system, 2 million inhabitants. It is very mixed population. What does it mean? 65% of the inhabitants are Macedonian Christians, 25% of the inhabitants are Albanian Muslims, and the others are blacks and Serbs and Turks. So the name of the Macedonian salad has its really meaning, because Macedonian salad, it means everything is, you can find everything in this kind of salad. It is a comparison with the Macedonian population. What is typically for the health rate in Macedonia? The life expectancy is not very long. If you compare with Japan again, Macedonians have a life expectancy of 74 years, and Macedonia has a pretty high infant mortality rate, which is about 12. Also, the unemployment rate is very, very high. And you see 33% of the population is without job. Looking about the age pyramid, it is pretty different when we make a comparison to Germany, because in Germany it seems like that 1/3 of the population is older than 65 years. And if you see the data here, you see that the biggest number of the population is very young in Macedonia. So this is the organization of the health system. I will not bore you about the whole of the structure, but I will tell you that in the last years there is a big tendency in Macedonia to establish a lot of private ordination and a lot of private clinics. And simply said, the situation is like that. The people who have money, they pay for their treatment privately and get nothing from the insurance. And the people who are poor, they get something, their treatment paid from the insurance, but the quality of this treatment is very, very bad. Talking about the costs of the healthcare resources, we saw from the other countries that in USA, 13% of the gross domestic product has been invested into the health. And when we are talking about Macedonia, only 5% of the gross domestic product has been invested into the health. So there's not a big amount of money invested in the health costs. Also, the general domestic product per capita is about 3,000 euro, which is on the lowest place at the level in Europe. So when we are talking about the reason for that in Macedonia, it looks like to be similar in other countries. The first reason for that are the diseases of the cardiovascular system. The second reason are malignant diseases. It means breast cancer is on the topic, the prostate cancer in the male. And then it is very typical in Macedonia that infective disease are also very important cause for reason. For example, brucellosis is a disease which is very rarely to find in the European countries, but is also reason for that. Or tuberculosis, it is also reason for that. As I have mentioned before, the death of the infants is very high. And the data, which are not shown here, but which, because they are not official, are talking about that the death from suicide is also very high.